Hello and welcome to COVID Ethics Update. This is a service of the Center for Practical Bioethics in the time of pandemic. Thank you for joining us today. And today we have a wonderful interview with Dr. John Yeast, who is a longtime supporter and leader of the Center for Practical Bioethics. We're going to talk about a very delicate subject, but one I think that most of you can really relate to, because I think it's a very important topic for today. This is a series that we've been running now for a good couple, 3 months, and we'll continue them. They're short segments of interviews with people who have something to say, a perspective that we think is important for the community and the stakeholders at large to learn about. So we're delighted to have John with us today. As I mentioned earlier, he's been with the center for a long time, and he actually came up with this topic as a way for us to maybe to engage in a really kind of, as I mentioned earlier, a delicate subject around the kind of the weaponization of the kind of the strident or if you will, the more ideological differences that we share as a nation, and the importance of us kind of coming together in a sense of solidarity or community to better respond to the challenges that we have with this devastating illness, this absolutely insidious challenge that we face as a nation. So John, thank you for joining us. Tell me a little bit about your background, your history with the center, and why you consider this issue around, I think we actually had talked about even masks. Wearing masks has become kind of a statement, either one side or the other, in terms of an issue around liberty versus this commitment that we have to each other in community. So tell us a little bit about your history, and then take it away in terms of kind of your perspectives and why you think this issue is so important for us to discuss.
Sure, thanks, John. I have really been involved with the center for a long time. I moved to Kansas City in late 1985. I'm a physician that became the director of the high-risk OB program at one of the hospitals in Kansas City. And at that time, the center was just a fledgling organization, but had interest in talking about the complex ethical issues dealing with complicated pregnancies, with infants that struggle with various conditions. And so we began a series of programs with the center of having what we called perinatal ethics rounds that rotated at hospitals around Kansas City. I subsequently became a board member and then became board chair. And over the last 25 years, I've been on the board 3 times and served as chair 3 times, and just finished about a year ago my last term. So I've had a long interest with the center and all of the ethical issues that make practicing medicine and being a patient a sometimes difficult issue. I became interested, as all of us are, with the COVID-19 pandemic and watching it play out from a scientific perspective, but also from a news perspective, because this was literally the first time we've had really a worldwide health problem that is instantaneously visible on many news channels with many perspectives. I've been delighted in the amount of scientific medicine that's come, scientific information that's become available fairly quickly in this process, and I think that physicians around the world have been able to respond in a way that we have learned much more about a new disease in a shorter time period than has ever occurred before. In my career, I can think of things like when HIV began to be a problem. It really took us years before we fully understood what the vector was, where it arose, how to deal with treating it, and it was a number of years before effective therapies were available. So to me, this everything that's happened in the last 3 or 4 months, or however long it's been, has been a amazing perspective on the instantaneous availability of knowledge and the way that people have worked together worldwide to come up with answers to difficult questions. My concern, which I've discussed with John and discussed with our board a bit, is that there hasn't the information about how to best control this is fairly obvious to people that follow these broad scientifically based recommendations. Yet we seem in this country to have a problem with the protection of others and protection of ourselves somehow being almost a political divide. It becomes an issue of my liberty versus your liberty. It becomes an issue of, do I have a responsibility for your health, and do I really care about your health, and I'm really concerned about myself. And some of these issues have become violent, and they have become tremendously divisive, and there's been demonstrations, and we've seen the things that have happened around the country in state houses, in stores, on streets, that have really been around the issue of trying to better control and treat an illness that we're now all confronted with. So I think that as the center, we need to be able to address these issues and begin to look at our responsibility to our fellow citizens, to our community members, to our church members, to all the various places that we normally are relating to people that we're not really doing right now, to end up with a better outcome and a faster resolution for this disease. And it has troubled me that we continue to see, again, thanks to an instantaneous news media, events that are causing great concern about how, as a country, we should best relate with each other.
So how do you think that we should, I think aspirationally, we can all agree that it's better for us to help each other out and to share in the burden of the sacrifice that we have to make for the greater good. You know, that's a kind of a fundamental utilitarian concept within bioethics that we all kind of agree, is that the greater good must provide us some sense of community identity and being able to move forward. But there are really, really strong needs that people have about being able to return to work. You know, you can die of this disease, or you can die of despair and you know, suicide and that kind of stuff. And I think there's a lot of that why is my death different than yours, or why is my anguish or my concern? How do we bring those two together? Because they're very, very different, especially related to the you know, essential workers who are absolutely needing to go to work, and at the same time absolutely needing our protection. And the way they get our protection is because we social distance or we stay at home. So it does really seem like a conundrum, a really difficult thing. What advice or counsel, what thinking have you been doing around that in terms of how we might bring people together better around these issues?
Well, I thoroughly understand and appreciate the issue about the economic despair that has occurred as we initially responded to this outbreak. The millions of people that are currently unemployed and wanting to go back to work and needing to go back to work. One of the things I would come back to, though, is I think that what we've done a very good job of in this country is to find the best solution to some of these problems as we work through it. So, for example, I've been very impressed with the more recent recommendations that have come out regarding restarting schools. Everybody totally understands the need to have kids back in school. Now there are guidelines coming out that begin to make sense, I think, from a medical perspective. There's new guidelines about spacing kids in school, to avoiding mixed groups like lunchrooms, serving kids in the room, being careful about other activities as they evolve. I think that businesses have looked at ways to protect their employees, and yet let people come back to work. If you've happened to go to even a carry-out restaurant or drive through a fast food restaurant, it's a completely different environment, protecting the employees as well as protecting the customers. So I think we do need to do these things, but I think we're learning, and again, we're having people come forward with ideas that make sense to begin to take these steps to come together. A few months from now, we may have other guidelines. We may have better guidelines. These may have changed, but schools, colleges, companies, even food processing plants that have had a lot of criticism because of outbreaks have put in resources and protective mechanisms and to try to help their employees. So I think that we have the capability, we have the knowledge, we have people that can deal with this, so it's not simply a yes/no answer. I don't have to do this because I don't want to, but rather, well, let's see if we can do it to allow people to come back together at work, at school, college. But I fully understand, John, that this is a big issue about going back to work, and many people are way past their last paycheck and needing help. I think that we have to keep that in mind.
It's kind of the livelihood argument, you know, it's which is more important, which is you know, essential for us to be thinking about as with the longer we're cooped up. There's also that sense of the psychological, you know, distancing also affects our psyche and our willingness to cooperate and be good at it. You know, the couple of things, in 1918, I think that the Kansas City region was one of the areas where the second wave came through, and we simply weren't willing to go back to isolation when we needed to. So we've got some lessons even locally to learn. I want to go back to the point you made earlier about instantaneous knowledge or instantaneous ability to find out things. And we've even kind of done that with masks. I mean, and that's one of the areas here I think that's been so politicized, is that early on there really wasn't a whole lot, at least from what we were hearing in the United States anyway, about the benefits of wearing masks. And now it's even getting to the point where there's a lot of good studies coming out. Some meta-analysis I know that I saw just this week. Aaron Bromish has been doing a lot from a biological perspective and talking about this issue. Atul Gawande has written about that if we actually do a good job of wearing masks consistently and staying 6 feet apart, there's a good possibility that we could get below 1 on the transmission rate, which then means it's going to decay. So those kinds of new emerging knowledge base kind of changes that, well, for me, kind of changes that perspective of the need for me to say a mask is a sign of my ability to have a liberty, when in fact it may be a changing message of saying there's really good science around this now. We may find out that this is one way for us to really overcome this whole thing. So what are your thoughts on that in terms of how to kind of use that emerging knowledge to if you will, convince or persuade people to kind of follow suit in what we're learning about the illness and the transmission?
Well, I agree with you. There are excellent studies coming out on the value of masks, but the ones you mentioned, Gawande's recent article, some of the studies from South Korea, I think looking at masks, and I think that it is a pretty simple thing to do to wear a mask when one is out in public and with other people. It needs, I believe it should be looked at as my own responsibility to protect others in the event I'm infected, but it also protects me, as has been shown in some of these more recent articles. And I have been encouraged just this week on one of my first few outings to shop, the very high percent of people that were wearing masks in the grocery store I happened to be in, and as well as the employees. And people were doing fine. They were maintaining spacing, and I'm pretty confident that one wouldn't have been infected in that particular store in that environment. I see it as not my liberty to not wear a mask, but more my responsibility to wear a mask so that others aren't infected. I think other simple issues also pointed out is washing one's hands and doing it frequently during the day, just doing it almost as a matter of course, not just when you think you maybe touched something that was contaminated, becomes a very good method of reducing your risk of becoming infected. These are beneficial to us as a society, but as you say, very beneficial to individuals because we may be able to get our conversion rate low enough that this becomes more an episodic disease until we get a immunization rather than something that is going to continue to have large clusters of cases.
Well, and that certainly affects you and me because we're both in that category of being high risk to begin with, given our age. So then wrapping this up, tell me how optimistic you are. How much I guess energy do you think we have as a nation to be able to put our shoulders to the grindstone and make this happen, so we can bring a sense of unity around this issue about defeating the illness and not each other, or not winning over each other. What do you think we've got ahead of us?
Well, with our working from home for a long time here, it kind of depends on, today's a sunny day at my house. So, I feel more optimistic today than I did yesterday or the day before when it was cloudy and rainy. I think that I think we have the ability to do this. Gosh, this country has been through some complicated times in the past. You mentioned the 1918 epidemic, that was a huge problem, but cities really did rally. And while Kansas City had a bad experience, there were other cities.
Oh, there were, yeah.
Even New York that did very
St. Louis
well.
did too, yeah. Yeah.
And so I think we can do that. We certainly went through the Depression and several wars. We have always ultimately come together. I think that to achieve the kind of resolution we need as a country, it's going to take all of us working on it. And I think that our legislators and senators and state governments and federal government need to come together and recognize we all have to work together. And I'm optimistic that we can do this. And I really want to do it in a way that's as safe as possible and allow the country to get back to a more normal time. I think it'll take a while, but I think we have the ability to do it. We just need to keep working on it.
All right. Well, with that sound counsel and good advice, we'll leave it at that. So thank you, John, for being with us, and thank you for bringing this issue up. I think it's a conversation that obviously we need to have in a lot of different homes and boardrooms and assembly halls and in basically under the dome in many capitals across this country. So thank you for being part of this COVID ethics update today and for bringing this topic to our attention.
Well, good. Thank you, John.
Well, thank you all for joining us for this episode of COVID Ethics Update. This is a service of the Center for Practical Bioethics. You can write us, drop us a note about other topics that you'd like us to consider at COVID@Practical Bioethics. That's COVID @Practical Bioethics. You can also subscribe to our YouTube channel where this particular episode, along with the other 20 or 25 or so that we've done already, exist, and be able to participate along with your colleagues, friends, and associates in the COVID Ethics Update series from the Center for Practical Bioethics. Thank you again for joining us. Stay safe and be well.